please explain kidney disease and how it affects the body?
Okay. So kidney disease is actually so broad, right? It's broad, and we have different forms of kidney disease. We have the acute kidney disease and the chronic, right? Recently, the one that has been in the news was actually had to do with chronic kidney disease. That's where we are most often trying to prevent, right? As well, acute is also quite dangerous. It can actually lead to chronic kidney disease. Acute is sudden um, derailment in the function of the kidney, right? And so sudden, right? But then chronic, it takes some time before it happens, and an acute actually lead to chronic, right? And so kidney disease means that something that is affecting your kidneys, right? We have two kidneys, obviously. And so recently it has been in the news, the dialysis and all that. And so it brought a whole lot of the buzz around the whole condition, yes. So affecting the body, your kidneys are supposed to, they are supposed to filter, right? They have a whole lot of functions that they do. They are supposed to filter your blood and then, produce urine, right? And they are supposed to as well filter some products like uric acid, your sodium, your potassium, electrolytes as well. And then they also help in the production of blood, right? Right. They have a hormone that they produce, erythropoietin, and so all these are functions of the kidney. So you can imagine if your kidneys are failing, you see, it's serious. It's all these functions are not there again, or all these functions are reduced, and so that is how your kidney disease actually affects your body. It goes on and on and on and on and on. So I think we'll talk about the causes and all that, and then we'll go further into it.
Okay, just a follow up on
Yeah.
what you explained. The acute one, please tell me how bad does it get to the point where it gets to the chronic
So
kidney?
acute kidney disease, right? So suddenly that one acute, just like the name, the name itself, acute. Suddenly your kidney function just goes down, or you develop a kidney problem, right? That one mostly it has causes. It has some causes. Major one being dehydration. It's also as well be, a cause can cause acute kidney disease, and that one, if it's not handled, if it's not handled well, it can develop into a chronic one. I think after, if it continues like that, and to I think 6 months, after 6 months, it will now be qualified as a chronic kidney disease. And so that is how it is. It's also as well very dangerous. Sudden drop of in your kidney function. Yes, it's actually very, very
But there's a
dangerous.
cure for that.
That there is a cause. There should be an established cause, because suddenly something is happening. So there should be an established cause, and if the cause is taken care of, whatever is causing it, if it's taken care of, you are good to go,
Okay.
right? And it has to be very quick when it's identified. So most often you go to the hospital, they try to identify what exactly is causing it, and if it's solved, you are good to go. You have no problem. That's how it is. It's not like chronic kidney disease where it's a progressive distraction of your kidneys, or progressive condition where it's in stages, stage 1 to 5, right? And so, yes, that one is different. That one is quite different. That's chronic. That's how it is.
So what are the common causes and risk factors of kidney disease?
Common causes of kidney disease. This one I would want to focus more on the chronic kidney disease, right? The CKD, yeah? The end stage kidney disease. So that there are various factors, right? There are some conditions, two key conditions that can actually cause chronic kidney disease, right? If they are not taken care of. One being hypertension, right? Hypertension, uncontrolled hypertension. If you are hypertensive and then you don't control it, right, by taking your drugs, right, it can damage your kidney with time. The second thing being diabetes, right? Diabetes, very, 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 very key. Uncontrolled sugar level can as well damage your kidney. So these two conditions are key conditions that if you don't take care, they can damage your kidneys. The next things are risk factors, right? Risk factors being alcoholism, right? Binge drinking, right? Can as well affect your kidneys, or can increase your risk of getting kidney disease. Smoking is also key, and some medications. Funny enough, a lot of people don't know this, right? Medications can also affect your kidney, right? Okay, let me mention some. some painkillers that we don't really respect. You can just go to the pharmacy, you can just go to the dark store or the chemical shop, and then you get some medications without really proper supervision from or by a professional, right? It can affect your kidneys. Painkillers, normal ones. There are some we call NSAIDs. So okay, let me mention some: diclofenac, aspirin, ibuprofen. You see those ones. If you abuse them, right, it means that by abuse I mean that taking them without verification or without supervision from a doctor or a pharmacist, you can actually hurt your kidney with time. Another thing about medication is herbal medications, right? There is this notion that people think if it's from a natural source, it's not dangerous. That is a lie, right? There are some herbal medications. There are the ingredients in some of the herbal products that are nephrotoxic. When I say nephrotoxic, it means that they can affect your kidneys or they are toxic to your kidney, right? Yes. So you need to take care. Be sure that whatever herbal medications you are taking are are verified or they are approved by the FDA. Approved, it means that they go through the necessary regulations, they go through the necessary tests to ensure or ascertain the fact that it cannot hurt your kidneys or your liver, right? Yes, so those are some of the risk factors for kidney diseases, yeah.
So, what are the early warning signs and symptoms of
Kidney disease, yes. So there's a tricky thing about it. You see, I mentioned the fact that there are 5 stages of kidney disease. The earlier stages, you don't see, most often you don't see symptoms. That's the dangerous thing about it. That's the funny part about it, right? You don't see symptoms, right? But when it's progressing, that is where you start seeing some symptoms like swelling in your feet, right? Start seeing symptoms like body itch, right? Yes, you know the kidneys are supposed to excrete something called uric acid, and if it's not doing that, it accumulates. So it becomes you get what we call hyperuricemia. It means that there are a lot of uric acid in your blood, and that can also actually manifest as itch, right? Yes, it's a symptom of that, and then changes in your urination is also one of the key symptoms of chronic kidney disease, where you take a lot of water, all right, but you produce scanty urine. So your urine is very little, right? And then even in the whole 24 hours, you don't produce urine at all. At that stage, you are supposed to be very, very, very concerned. You are supposed to go to the hospital for tests because it's not normal. Yes, so those are some of the symptoms, signs and symptoms that I can mention with regards to kidney diseases.
So I have this follow-up question. So, are there any tests available for you to just go to the hospital randomly and say I want to test for my kidney? In order to, because you mentioned that the first early stages you won't even know
Yes.
that your kidney is failing
Yes.
you. So there has to be like a particular test you can be running maybe every 6 months to check your kidney.
Yes, that's a smart question. Yes, so you see, the last time I was on a space with Ross Stone, and he mentioned the fact that people normally check their cars, send their cars for maintenance and all that, but they neglect their own bodies, right? That is the thing. You should be able to at least once in a year, go to a facility, go to a hospital and say that I want to just check my body, right? Regular checkup. Check your kidney, check your liver, do your whole body checkup, right? It's very, very necessary. There are tests there. You check your EGFR to see how, which stage are you, whether your kidneys are working well. There are kidney function tests that we do, right, that are done, right, to know or ascertain whether your kidneys are really up to the task, right? So yeah, there are tests there. You can be doing it. You can do it every 6 months. And there's this trick that you can use. Your birthdays. You can attach body checkup to the treats that you give yourself during your birthday. See, it makes it easier and it makes it easy for you to remember. So yes, there are tests there that you can do.
So when I asked earlier about the causes of kidney disease, you mentioned alcohol, you
Yeah.
mentioned smoking, but are there foods that you eat that can contribute to your kidney failure?
Foods, as of now, I haven't seen any evidence that shows that a certain food would destroy your kidney or can cause kidney disease. I haven't seen any evidence. Science evolves. So maybe right after here, I can read something online or I can read some article that says that this particular food has caused a kidney disease. But as of now, I've not seen any food. But the only thing I'll say is about the herbal stuff, right? Where herbal medications are good, very good. In fact, some of the medications that are sold in the pharmacies are of herbal origin, right? So they are very good, but you need to be careful the kind of herbal medication you are taking and where you are taking it from, the source, whether they are approved. That is where my concerns are as of now. Yeah, but whether food causes kidney disease, that I have not come across yet.
Okay. So can you please share insights of the prevalence of kidney disease in Ghana?
So yes, this particular question is I don't say it's quite unfortunate, but yes, blacks have higher risk to kidney diseases compared to the other races. Yes. So we are of higher risk. That's why I am more concerned about talking about prevention, ways to prevent, right? So when I see people blasting their lungs, blasting it with smoking and all that, binge drinking and all that, I become concerned because we are of higher risk compared to the other people that we claim we are copying, right? So yes, black
Can you
Africans
tell us more?
are of higher risk.
What lifestyle changes or what way of dieting would you recommend to people in order to prevent or maybe even manage kidney disease?
Okay, so lifestyle changes a lot of them. First one is drink enough water, right? Drink enough water. If you want to protect your kidneys, drink enough water. You see, most often on my Twitter pages or my X page, I every 1 p.m., 2 p.m. I come. If you can see this, drink enough water, go and drink water, something like that. So yes, water. Your kidneys love water. I mean, they need water, right? In fact, your body needs water. So to protect your kidney, drink enough water, at least 2 liters a day, right? That is one. Two, if you smoke, quit. You see, smoking is not, it's also a risk factor for kidney disease, right? So just quit. Just quit. It's not only for kidney disease, all the other, most of the non-communicable disease, smoking is implicated, right? And even on the box, the smoking packs, they've written it's there, right? Smokers die young. Smoking causes lung cancer and all that. So smoking and alcoholism, avoid excessive drinking, what we call binge drinking. Avoid it, right? And regular exercise. This one, when we mention it, it looks like a cliche, something that we normally just say to just maybe look or no, it's actually serious. Exercising is one activity that protects you or prevents a lot of the non-communicable diseases. A lot. So at least 30 minutes to 45 minutes of exercise a day. It's not bad, right? At least 3 times a week, at least do some exercise. If you have an office that every day you're taking elevator, sometimes take the stairs. I mean, 2 times in a week, it doesn't kill, right? Yes. Ride, bicycle, swim, walk. Sometimes park your car if the distance is not far. Park your car and walk, right? Jog, do all those exercises. It helps the body and it helps your organs as well. So and it prevents a lot of non-communicable diseases, right? That is another way, another lifestyle that. And then with diet is very important. Diet is key, right? Diet, make sure that you are taking a lot of greens, a lot of vegetables, fresh fruits, right? Sometimes people come to the pharmacy or people go to the hospital, oh, I want to boost my immune system, give me vitamin C, give me citrus C and all that. You can just go to the market, buy fresh fruits, and you get a lot of those vitamins in those fruits without really going to the pharmacy to buy drugs and all that. So yes, eat fresh fruits, right? That is fine. And then another thing about taking drugs, make sure that whatever medication you are ingesting, whatever drug you are taking, they are being supervised by a professional. Your pharmacist is aware, your doctor is aware, right? Either your pharmacist or your doctor is aware, so that you don't go and take something that will be hurting your kidneys, right? So these are some of the lifestyles that if you put in place, you should be protecting yourself from some of these conditions.
Okay. So, what treatment options are available for those that have kidney disease, and how effective are they?
I said kidney diseases are chronic kidney disease is a progressive condition. So yes, there are treatments available when you go to the hospital. There are treatments available, right, to help manage your condition. So if you're hypertensive and that's actually caused the kidney disease, they try to manage your hypertension and try to manage this one. But with time, it's a progressive disease. With time, um, the kidney still gets destroyed. So with time you get there. But yes, there's dialysis when you get to the end stage where your kidneys are function is just gone. There is dialysis for you, and there is also transplants. Very effective when you are able to have the funds and you have a donor that matches with you, and then you can go for kidney transplant. Very it's effective. I mean, so yes, these are options. But with CKD or chronic kidney disease, they just manage you, right? They manage it for you. But it's effective. It's effective. People are alive with CKD for years, so it's effective.
So, with end stage, and you have to get new kidneys, like you can't even heal. Can you heal the one you are managing?
That's a scary thing. With end stage kidney disease, it means that your kidney function EGFR is way low. So there's nothing that can be done if you want a definitive treatment. Let me say definitive. That's the transplant. They replace the kidneys for you, and it picks. Cool. You are good to go. But aside that, we can just manage with dialysis, and then be managing your blood pressure and all that. That is when manage the other symptoms that it comes with. Aside the transplant, there's no other definitive treatment there that I can say. Yeah.
So, with dialysis, you can't live with dialysis, like live years without dialysis.
Oh, people live years with dialysis.
And if they choose not to have a transplant, they can still live long with the dialysis.
Yes, they can live with dialysis. Yes, they can. It's like the dialysis is taking the work of the kidneys. It's as simple as that.
That is expensive.
Yes, you know, it's expensive. It's expensive. It's
So,
expensive.
the
Capital
long-term plan
intensive.
should be to get.
Kidney transplants. That's it. That's the long term.
Okay. So, are there any new advancements or innovations in the field of kidney disease management and treatment?
That I don't have a lot of information on, right? But for now, it's the kidney transplants that I know. Yes, those are the innovations that I have.
Okay. So, what advice would you give to our audience about maintaining kidney health and preventing kidney disease?
Okay, so that I've mentioned a lot of them. Take enough water. Take fruits. Exercise, very very important. Um, Yes, and then the medications, very, very necessary, very important. You don't take medications that have not been approved or prescribed by your pharmacist or by your doctor, right? So yes, those are some of the main things that I would say. Aside that, there are more. There are more. There are more. Yeah.
So, can you share a few success stories of people that have had kidney diseases, but they were, able to manage it and they are fine now?
Oh, for kidney disease, I mentioned acute kidney disease. Yes, I've seen in a hospital. I've seen people that came with acute kidney disease. They were able to find out what was causing the injury, and then they managed it for them, and they are cool. They are I mean they are okay,
For them,
but
there is no transplant. They don't need a transplant.
they don't need it. Acute, if the cause, whatever is causing, is solved, you are good to go.
I have a question though.
Yes.
I've been told that if you had acute before, you can't sell your kidney. Is it true?
that's I don't know. I don't know, but
Is
I
one not
doubt. I
enough
doubt.
to sell?
So with that one, if you want to sell your kidneys, they'll do the tests. When they do the tests, the various tests, and then your kidneys are working well, there is no problem, anything hindering it's. I mean, work. You can go ahead and donate. Yes, you can go ahead and donate.
So my last question, can you take me through the entire process to the point where you get a new kidney? So like maybe first you get diagnosed, then you run some series of tests or you do some medications, then maybe dialysis. getting a donor? Like, I want you to take me through the process
It's seriously
of getting, of like, finally getting a new kidney.
it's a whole lot of legal stuff,
Okay.
right? I know it's a whole lot of legal stuff, but you are diagnosed of it. You don't go looking for kidney if you don't have CKD or if you're not end stage renal disease, right? And so yes, they'll start looking for somebody who matches you, right? And then if the person is willing, the person is willing to donate, they do the legal stuff. You have to go to a legal sign some papers and all that before, if you matches with the person's kidney, then you go ahead and do your it's not a straightforward thing. It's a whole process, yes.